tens of millions of dollars for substance abuse treatment in the islands. That's what dozens of recently awarded state contracts call for across the state. Bryce Moore has details.
The Department of Health recently awarded 30 contracts to provide treatment and recovery for those addicted to alcohol or drugs. Doctors say it's a big deal for underserved populations.
Oftentimes, insurances will only cover a certain amount, and then so there are lots of gaps of service still. And so this grant is providing a lot of help into providing more access to care.
Waianae Coast Comprehensive Health Center was awarded a $500,000 contract. Child and Family Service received $1 million. $900,000 is going to Maui Youth and Family Services, and the Big Island Substance Abuse Council is getting $5.5 million, just to name a few. In total, about $46.3 million will be doled out across the state.
Hi everyone! Today my group and I will be discussing substance abuse in Hawaii and how it impacts our community in social, environmental, and economic ways. We'll be using the 5 major approaches to break down our findings and share our plan for change in partnership with Hina Mauka. This topic matters because it doesn't just affect individuals, but it also affects families and the wider community, including health, school, work performance, and relationships.
Our plan provides a solution to the problem of substance abuse among young adults in Hawaii while supporting the 3 pillars of sustainability: the social, environmental, and economic. The social aspect to our solution to the problem of substance abuse includes community outreach to school-based prevention programs such as DARE, which will increase education on substances as well as mental health counseling, peer leading activities to spread awareness on the stigma of substance abuse. By improving the support systems in high school, it will help young adults be more likely to use positive coping strategies and know the dangers of substance use. The environmental component of our solution is to implement proper disposal systems for unused or expired drugs and substances. This can be things such as pharmaceutical take-back programs or even designated disposal areas to prevent contamination in our environment. Expanding the awareness of proper disposal practice can prevent these things from contaminating our water systems and ecosystems. Lastly, the economic side of our solution consists of increasing funding for rehabilitation centers. This allows for greater access to treatment services for young adults to give them proper care for substance abuse recovery. By investing in this, we can have long-term healthcare expenses that we previously had economically. Our solution is also aligned with the several key United Nations Sustainable Development Goals. Our solutions are consistent with SDG 3, good health and well-being, by supporting individuals' mental and physical health by having access to both resources to prevent substance use to be a problem in their life. Our solutions are also consistent with SDG 10, which is reduce inequalities by decreasing the power imbalances of substance abuse recovery in society by increasing funding in institutions. Reducing the imbalance will allow for less socioeconomic inequalities among humans due to their substance abuse struggles and make for more people to have better chances at keeping their jobs after recovery. The last SDG that aligns with our solutions is SDG 6, clean water and sanitation, due to our focus on increasing drug disposal sites to be better of our water and increased sanitation.
Our project uses interprofessional education by bringing different professions together to address substance abuse in Hawaii, especially among young adults. By improving access to services and supporting culturally grounded programs, we aim to provide counseling, resources, and psychological support. This approach helps individuals recognize challenges early and promotes prevention while strengthening the community through teamwork.
Our solution integrates system theory because substance abuse is not an individual issue, rather a behavioral issue that is shaped by family members, community members, culture, and also the environment. According to an article written by Scott Okamoto, it states, much of this literature has focused on the influence of various subgroups on the drug-using behaviors of these youths. System theory suggests that substance abuse is a result of integrational influence that increases the likelihood of addiction. The quote directly aligns with system theory because it shows how this problem emerges from harmful patterns that affect a person's choices. When this behavior is normalized, the family members, peers, and even friends become a part of this harmful loop.
Our plan for change solution incorporates micro, meso, macro approaches to target different aspects of the problem. At the micro level, we can focus on interventions for individuals. Additionally, people may benefit from counseling and mental health services. Systems such as like mentorship, Alcoholics Anonymous groups, and meetings, and recovery coaching can help individuals understand their root cause of why they are abusing substances. Lastly, we can promote coping mechanisms and healthy lifestyle choices through education systems to suggest better decisions early on for young adults. From the meso level, people like schools, colleges, and local organizations in Hawaii can create prevention programs and support groups. Campus awareness campaigns and community workshops can also reduce the stigma of alcohol abuse and get people talking about the issue. Finally, healthcare providers and churches can expand access to resources for those in need. From the macro level, we can increase government funding for mental health and substance abuse programs. Additionally, they can create more stricter laws on drug distribution and overall address larger issues that such as like cost of living and unemployment that reduce to the stressors contributing to substance abuse.
Our project uses the ecological perspective by showing how substance abuse is influenced by multiple factors within a person's environment. In Hawaii, young adults are affected by their surroundings, including their community and the systems around them. By looking at the micro, meso, and macro levels, we can better understand how these influences shape behavior and why early support is important to prevent harmful habits.
For our community engagement forum, we decided to target an audience of 18 years old to 24 years old. It was essential that we made this community engagement forum because we aren't able to design an effective substance abuse solution without understanding what the community is actually experiencing. With that being said, this is all the data that we have collected. The first question was, how serious do you believe substance abuse is in your community? Out of 29 respondents, 0% answered not serious at all, 34.5% answered somewhat serious, 41.4% answered averagely serious, and 24.1% answered extremely serious. Question 2, what substance do you think is most commonly misused in Hawaii? Nicotine, marijuana, opioids, or cocaine? Out of 29 respondents, 44.8% answered nicotine, 37.9% answered marijuana, 10.3% answered opioids, and 6.9% answered cocaine. Question 3. How comfortable would you feel seeking help for substance-related issues? Out of 29 respondents, 20.7% answered not comfortable at all, 41.4% answered somewhat comfortable, 17.2% answered averagely comfortable, and 20.7% answered very comfortable. Question 4. Are you aware of any government-funded programs for prevention or treatment? Out of 29 respondents, 44.8% answered not aware, 39.7% answered somewhat aware, and 17.2% answered very aware. Question 5. Do financial stress and unemployment contribute to substance use in your community? Out of 29 respondents, 55.2% answered yes, 10.3% answered no, and 35.4% answered maybe. Question 6. Do you believe more funding should be allocated to substance abuse education and rehabilitation? Out of 29 respondents, 86.2% answered yes, 0% answered no, and 13.8% answered I'm not sure. Question 7. Have you or someone you know ever been directly affected from pollution of drug use? Out of 29 respondents, 55.2% answered yes, 23.1% answered no, and 20.7% answered I'm not sure. Question 8. How well is your understanding of the environmental effects of growing pharmaceutical compounds? Out of 29 respondents, 24.1% answered not very well, 6.9% answered pretty well, 58.6% answered meh, 6.9% answered somewhat well, and 3.4% answered very well. Question 9. Do you believe there are proper precautions to avoid harmful substances in daily resources? Out of 29 respondents, 72.4% answered yes, and 27.6% answered no.
We chose to connect and partner up with Hinamalka because their mission focuses on helping individuals overcome substance abuse through education, treatment, and community support. They also understand the importance of culturally appropriate care in Hawaii, which makes their programs more effective for the people they serve.
My name is Harrison Peters. I'm the executive director, and I chose to work for Hinamalka because I have a passion to teach young people about senior because it's the biggest, fastest growing population.
And then what is the goal of the agency that we're at currently? What is your goal?
The goal is to meet the needs of our families and seniors that have largely systematically been ignored.
Overall, we've learned so much through this project and exploring this issue of substance abuse among young adults. We've not only learned through research, we've learned through experience, as well as our community engagement. Through the community engagement, we were able to talk to someone who has worked with recovery of substance abuse, which is not an easy process. It is a very tricky, challenging process for many people who are struggling with this issue. We have also learned that besides socially, substance abuse affects our environment a lot due to proper disposal. And if there isn't a proper disposal, it can get to our water systems, as well as the makeup of drugs leads to deforestation. Economically, drug deaths do cost a lot of money, as well as access to recovery costs a lot of money, which causes people not to be able to go into recovery and get the proper help that they need. Overall, this is not a one-person issue. We as people need to learn what we can do, which is volunteer at recovery places, donate. We can also overall just, be able to talk to people who need help.
Hinamalka is one of the agencies that's really trying to do something about drug abuse. They've got a lot of innovative programs, and one of the things they're trying to do is start a program similar to the Delancey Street program in San Francisco, which has been very successful over decades now. Yeah. And the Delancey Street program, as I understand it, really focuses on working with drug users for as long as it takes in a particular context. It's not an easy program for a drug user to go through, but it deals with the totality of your life. They have work programs, they have counseling programs, they have family reunification, but and they don't have a thing where your 30 days are up, so you're out. You're there until you're ready to go. So that's the kind of model I think Hawaii really needs to consider, and I'm really glad that Hinamalka is looking at it. To turn a drug user and make him or her into a taxpayer instead of a simply a service consumer, I think is huge. It's a huge thing that we could do.